Good morning, mister. My topic is the effect of a strong receptor beta on mandibular condylar ground. Introduction. The mandibular condylar cartilage plays a central role in craniofacial disorders such as mandibular ground abnormalities, micronactia or prognathia, and temporomandibular joint degeneration afflicting over 50 million Americans. The mandibular condylar cartilage differs from other endochondral ossification and roughly remodels during round to mechanical loading growth. However, women between the age of 44 and 45 years are the most likely to seek treatment, suggesting a role for estrogen in the disease process.
The estrogen receptor, molecular and cellular mechanisms. Like all steroid hormones, estradiol circulates throughout the body via the vascular system and freely diffuses through membranes of cells in the body. In most cases, estradiol molecules travel through the cellular cytoplasm and then migrate into the nucleus, where the steroid exerts its major effects on cellular functioning. Steroid hormones, including estradiol, exert their effects by interacting with a special class of proteins called steroid receptors, found in the cells of target tissues. These receptor proteins have very specific binding properties and therefore associate with steroids and other chemicals in very particular ways. Estradiol and other estrogenic substances bind to the protein called the estrogen receptor. Although estradiol binds and activates estrogen receptors in both the cellular membrane and the cytoplasm, most of its sustained effects on cellular functioning are the result of its interactions with estrogen receptors in the cell's nucleus. In the absence of estradiol, estrogen receptors are distributed throughout the cell nucleus. These receptor proteins are large, complex structures that include a pocket called the ligand binding domain, into which estradiol will eventually bind. In the absence of estradiol, receptors are associated with a large cluster of proteins called chaperones that serve to keep the receptor in the correct conformation to allow estradiol to approach and bind to the ligand binding domain. When estradiol enters the nucleus and begins to interact with the receptor, the chaperone complex dissociates from the receptor and estradiol binds to the exposed ligand binding domain. As a result of this interaction, receptor complexes form clusters within the nucleus in the region of the chromatin.
Application in dentistry. Estrogen receptor beta has a liberating effect on the stroprogesterone vein. This protective of inflammatory mechanism. So the women with a lack of the circulating hormones have an increasing in inflammatory cytokines, inhibiting the formation of the new bones, consequently promoting resorption condylar and decreasing bone density.
In our office, we do zero surgery to treat TMJ. In our office, we know that 90% of headaches come from muscle fatigue. So a lot of the symptoms that people seek out treatment for their TMJ are related to pain. So what we know about the muscles is that if we can get them calm, then that means they're in a good balance. And if we can get a good balance with the teeth, how the teeth meet together, how the muscles meet together, then we can get you in a better position to where the TMJ is not painful or anything like that. That being said, there may be indications where other doctors may need to be involved. If you say if you were in a car accident, or you had some kind of accident where your bone to bone, how they meet are causing issues, or physical therapy. So there are indications for other modalities in the treatment of this, but what we found is that 90% of the time, headaches are caused just simply by muscle fatigue without any accidents causing any TMJ problems. In our office, if you were to come in, this is how we would treat you. We would take photos. We're going to take a look how the teeth come together. If the teeth aren't coming together properly, we know that there's also going to be a muscle imbalance there. If there's a muscle imbalance, there's going to be fatigue, and that can also relate to headaches. So what we'll do as our first course of treatment is to test to see if we can get your bite in a comfortable position and get the muscles relaxed. We'll make what's called an orthotic that goes on your lower teeth without doing anything permanently to your teeth. We're going to be adjusting the bite. We're going to be running computerized scans to see how your bite is tracking and how the muscles are being relieved. And there's all these facets that we're going to be doing over a 6-week period of time to see if we can get you comfortable. If we can get you comfortable and you start feeling more comfortable, then we can find out permanent options for you. Permanent options may be moving your teeth with orthodontics into that position of your comfort, and other options may be doing porcelain crowns and veneers to get your teeth into that position where they have a home. And sometimes it's a combination of both of those, moving your teeth and rebuilding some of the teeth. A lot of times when we rebuild some of the teeth, a lot of the teeth are already worn so much that we don't have to do a lot of work to the teeth because we're adding and building up to the teeth. So in our office, that's kind of how we treat our TMJ patients, and surgery is not done in our office.
The pros. The severity of symptoms is related to the age of the patient. The probability that is affected is low. The prevalence is lower for postmenopausal women. Conclusion. The mandibular condylar is considered an important seat of regional adaptive ground, expression of several ground and transition factors that modulate cell proliferation of chondrogenic, fibrogenic, and osteogenic, and systems of extracellular matrix molecules are expressed both during mechanical stimulation. Estrogen inhibit the growth of articular cartilage. Thank you.